Catheter is placed so that we have instantaneous access for administration of fluids and medications while the pet is with us. Because we're introducing something into their blood vessels, we want to make sure that it is aseptic, which means there's no chance of introducing pathogens or dirt or bacteria, and we have a clean port of entry. This prevents infection from getting into their system. So the first step of this is going to be to shave their leg. All right. So now that I've got an area that's clipped, I'm going to get Ashley to hold this hair out of the way. And we're going to use an antiseptic scrub. And I'm going to scrub it several times, starting at where my point of entry is going to be and working away from it. And the reason I do that is so that I move the dirt away from where I'm going to be placing the catheter. We are going to introduce the catheter into the vein. Make sure that that moves freely. Okay, I get a little bit of flash, and then I just slide the catheter on up. There we go. Now for the hardest part, believe it or not, which is taping the catheter in place. All right, before I put my final piece of tape on, I'm going to check my catheter to make sure that it's in the vessel and doing what I need it to do. The catheter hub will actually let me insert needles multiple times, which allows us points of access. It's moving freely. Ashley, are you feeling it?
I do. It feels flowing great.
One last piece of tape on to keep it snug. Has a bug and a rug. There we go. These catheters get checked multiple times a day to make sure that they're still patent. We also check for swelling, redness, inflammation, irritation, anything that looks like there may be an infection starting. Most catheters are safe to leave in if placed appropriately for up to 72 hours.